I've always thought, data ownership was a very interesting
Yeah.
thing in healthcare, right? Because it's not really defined. Like, if you put something in the EMR, right, and there's like major EMR systems that kind of have ownership over what you place in their system, right, over that note, the information associated with that note. But then the information itself is about a patient, right? And so is the health information being put on that note owned by the electronic health records, like the software system housing that? Is it the patient, or is it the physician that's collecting that information from the patient, right? And so I think there's a lot to unpack there in the sense of like who gets that ownership, how can we track that data across time, because with fragmented EHR systems and everything too, right? If a patient goes to one health system, they have their own EMR. They go to a different small clinic, they have their own EMR or lack thereof. And so
Mhm.
it's very hard tracking patients across time and having data fidelity, or like the labs or tests that you run on a patient, really keeping track of that if you're not integrated with one system. And then that opens like the question of like the can of worms of like, is healthcare consolidation good because it can be integrated in one system, right? Because
Mhm.
that's one possible solution that you can think of for making care integrated. But then again, that brings into question data ownership, autonomy, and agency for people within that system as well. Lots to unpack there. I just wanted to provide my thought for that, and just what your thoughts are on the utility of blockchain or these within healthcare, and how you see these problems that I just laid out in terms of like data ownership and who has ownership over that data that we collect in healthcare.
Yeah, aside that is a really good kind of overview and summary of not only the problem but of uh, you know where we're going, ways to think about this. Ownership is obviously super important. I think most people would agree that foundationally it should be the patient's data and the patient's information. But what we also have to consider, and that you didn't mention, is what data is being incentivized and optimized for by these EMRs. And right now, it's data for billing and coding. So, how much of an EMR record is actually really, fundamentally important for the patient, and then how much is used for insurance, coding, billing, leveling, all of those things. So the data is kind of carrying the patient's crucial information for us as providers, as like a small backpack on this mountain of medical legal garbled gobbledygook that's like there to protect us from liability and doesn't do that. And then all this coding and all these ridiculous rules and hoops we have to jump through. So when we code a patient's chart, we're not just relating to another doctor or another provider or another or a nurse or someone or the patient what's going on. We're not. It's not just like um, distilled, concentrated, important, crucial data, which it should be. Right now it's like a preponderance of data that we don't even need or care about, but that helps us bill and code and make money for insurance companies, and it's absolutely awful. So but the main real world where the rubber hits the road problem that we want to solve with blockchain and decentralized open systems, and ultimately a decentralized open EMR, which the patient controls and carries with them wherever they go, is I'll give you an example. I'm an ER doc. I no matter where I've practiced, people come in from other systems, other healthcare systems, other closed systems, and it's like, well, I'm seeing over at the hospital down the street, or I'm visiting from Australia, or I'm visiting from New York. I ran out of my medications, and it's like, oh well, we need to get your medical records, and like an hour later, if we're lucky, they're faxed over to us. Sometimes we never get them. Sometimes it's impossible to get them because the the medical records department is closed at another facility or a rural facility or something like that. And so, like we miss the crucial pieces of the data. And now with the cell phones and with everything that we have, how on earth do you not just have an app with all of your most important healthcare data? Everyone should have this, and it can be protected in a blockchain capacity